Welcome to our medical assistant practice test. This test has 100 questions to help you prepare for your medical assistant certification exam. Each question includes an explanation of the correct answer. Whether you're new to being a medical assistant or want to review your knowledge, this practice test will give you an idea of what to expect on the real exam. Let's get started. 1. Coding systems are A. Used to place verbal descriptions of medical conditions or procedures into alphanumeric codes. B. A method of monitoring disease processes. C. Used to allow for easier statistical tracking of medical conditions or procedural uses. D. All of the above. Correct answer, D. All of the above. Coding systems are a way for medical conditions and procedures to be listed as a number. This allows for easier tracking of statistics related to this information. It also allows for easier communication between physicians and healthcare insurance plans. 2. ICD-10 coding books. A. Are organized into 3 volumes. B. Used to code diagnostic procedures. C. Are revised biannually. D. None of the above. Correct answer, A. Are organized into 3 volumes. ICD-10 coding manuals are organized into 3 separate sections, each with its own function. Volume I is the tabular list book. Volume 2 is the alphabetic index book. Volume 3 is the procedure coding system book. 3. Volume 2 of the ICD-10 coding book. A. Is the 4-part alphabetical index. B. Contains procedural codes for specific diagnostic tests. C. Contains 3 sections with section 3 being the index to diseases. D. None of the above. Correct answer, A. Is the 4-part alphabetical index. Volume 2 of the ICD-10 coding book has 4 parts. Alphabetical index. It is used first when searching for the correct diagnostic code used for a disease state. Table of neoplasms, table of drugs and chemicals and external causes of injuries index. Volume I tabular list is then used to confirm that the code chosen is correct. 4. The CPT coding book. A. Provides a 5-digit code for all procedures or services that may be performed on a patient. B. Provides numeric codes that allow for easier communication with insurance providers. C. Is divided into 6 sections. D. All of the above. Correct answer, C. Is divided into 6 sections. The CPT coding book is used to code procedures and diagnostic testing. The manual is divided into 6 sections and contains 5-digit codes for medical procedures. 5. The Write It Once system is used in some offices as an alternative to A. Computerized scheduling systems. B. Hospital referral services. C. Computerized bookkeeping. D. Medical resource allocation. Correct answer, C. Computerized bookkeeping. Write It Once systems are sometimes referred to as pegboard systems where financial information is written once but recorded in 3 different places. 6. Restrictive endorsements on checks. A. Limit how a check can be cashed. B. Restrict the amount of money that can be received from a check. C. Prevents inaccurate records of deposit. D. None of the above. Correct answer, A. Limit how a check can be cashed. A restrictive endorsement limits the ability of a person to cash a check. Restrictions are placed on checks to ensure the proper person or organization cashes the check. 7. When depositing checks in the bank. A. A deposit ticket must be filled out. B. Bills and checks must be listed individually. C. A signature is needed to withdraw cash. D. All of the above. Correct answer, D. All of the above. Depositing checks into the bank requires the movement of funds from one person to another. The process is controlled to ensure that mistakes in documentation do not occur. 8. A check stub. A is a smaller form to the left of each check that is used to manually record information placed on the check that is distributed. B is a booklet containing the banking information for the office. C is information that is used to deposit funds into the holder's account when signed by the payee. D. None of the above. Correct answer. A is a smaller form to the left of each check that is used to manually record information placed on the check that is distributed. Check stubs are the pieces of a check that is left over when a check is pulled from the perforation in the checkbook. These stubs are used for reference when balancing the checkbook for accuracy. 9. In order to ensure that a check can only be cashed once. A. The office manager should keep a running list of all of the checks used by that office. B. The bank will destroy all checks and any records of the check. C. Checks that have been cashed should be locked in a designated area. D. Checks are stamped by the bank when cashed. Correct answer. D. Checks are stamped by the bank when cashed. Checks are stamped by the bank and considered cancelled when funds have been moved from one account to another. 10. Deductions are: A. Money owed to the practice. B. Also known as debits. C. Amounts that are to be added to the check register. D. None of the above. Correct answer. B. Also known as debits. Deductions are sums of money that are removed from the account. They are also known as debits. Deductions are often in the form of payments from the office to a vendor or utility company. 11. A patient is describing a contusion of his arm over the telephone to you. Which of the following descriptions would closely describe a contusion? A. Blood collecting under the skin without a break in the skin. B. A clean cut that has broken the integrity of the skin. C. A jagged cut that has broken the integrity of the skin. D. A puncture which has pierced the top layers of the skin. Correct answer. Blood collecting under the skin without a break in the skin. A contusion is bruising of the affected area, also known as an ecchymosis. 12. The elderly and very young. A. Have increased susceptibility to infectious pathogens. B. Are more sensitive to heat and cold. C. Have a higher risk of falls. D. All of the above. Correct answer. D. All of the above. The young and elderly have increased risks for medical emergencies including heat injury, infections, and falls. 13. Which would be the first step when a patient passes out at the front desk? A. Call 911. B. Initiate CPR. C. Shake the patient and ask if he is okay. D. Check for a pulse. Correct answer. C. Shake the patient and ask if he is okay. Anytime a patient passes out or appears to be sleeping, shake the patient to see if you can rouse him. Checking for a pulse, calling 911, and initiating CPR would all follow if the patient does not become alert. 14. Which of the following is considered a best practice when preparing the office for emergency situations? A. Document all training of employees on emergency situations. B. Require all employees to have current CPR certification. C. Have a current copy of all MSDS sheets for all chemicals used in the office. D. All of the above. Correct answer. D. All of the above. Preparing the office for an emergency would include training on emergency procedures, documentation of the training, keeping all employees current on CPR certification, and providing employees with documentation of policies and procedures for emergency situations, including proper health information such as the info provided through MSDS sheets. 15. When performing CPR, at what rate should chest compressions be applied? A. 100 per minute. B. 60 per minute. C. As quickly as possible. D. 200 per minute. Correct answer. A. 100 per minute. Chest compressions given during CPR should be done at a rate of 100 compressions per minute. 16. A patient presents to the office with a pencil that has completely penetrated the palm of her hand. Which of the following treatments would be best in this situation? A. Assist the doctor while she sedates the patient and removes the pencil from her hand. B. Have the patient gently pull the pencil out of her hand and assist the physician with stitches. C. Wrap a gauze wrap around the pencil, securing it as much as possible until the patient can get to a local emergency room. D. Tell the patient to go to the local emergency room. With a doctor's order, give the patient some aspirin for the pain. Correct answer: C. Wrap a gauze wrap around the pencil, securing it as much as possible until the patient can get to a local emergency room. Penetrating wounds that leave behind an object may have broken and then blocked important blood vessels. Removing the object may cause intense bleeding. The patient's wound should be gently wrapped with the object intact. The patient should then be taken to the nearest emergency room to have the object removed. 17. Which acronym would best describe the procedure for assessing a patient that appears unconscious? A. WBC. B. QRS. C. XYZ. D. ABC. Correct answer: D. ABC. The ABC method stands for airway, breathing, circulation. When encountering a patient who appears unconscious, first assess for adequate airway by performing the head lift, chin tilt. Next look, listen and feel for breathing. Finally, check for a pulse. 18. Which of the following vital signs can be expected in a child that is afebrile? A. Rectal temp of 100.9 degrees Fahrenheit. B. Oral temp of 38 degrees Celsius. C. Axillary temp of 98.6 degrees Fahrenheit. D. All of the above are incorrect. Correct answer: C. Axillary temp of 98.6 degrees Fahrenheit. Afebrile means to be without fever. An axillary temperature is taken in the armpit and is normal at 98.6 degrees Fahrenheit. 19. Intermittent fevers are: A. Fevers which come and go. B. Fevers which rise and fall but are always considered above the patient's average temperature. C. Fevers which fluctuate more than 3 degrees never return to normal. D. None of the above. Correct answer: fevers which come and go. Intermittent fevers are fevers that come and go. They alternate between periods of being febrile and afebrile. Continuous fevers rise and fall slightly over a period of 24 hours. Remittent fevers fluctuate considerably, more than 3 degrees, and do not return to normal body temperature. 20. A patient's body temperature has varied over the last 24 hours from 97.6 degrees Fahrenheit in the morning to 99 degrees Fahrenheit in the evening. The patient is worried that this change in temperature may indicate the beginning of a fever. Which of the following best explains this phenomenon? A. The patient definitely has a fever in the evening and should be seen by a doctor. B. The patient is experiencing changes related to a diurnal rhythm. C. The patient is more than likely taking her temperature incorrectly. D. The patient is male and is experiencing changes related to fluctuating monthly hormones. Correct answer: B. The patient is experiencing changes related to a diurnal rhythm. Diurnal rhythm is the phenomenon of body temperature fluctuating depending on the time of day. Temperatures taken in the morning are typically lower than those taken throughout the rest of the day. 21. The most accurate reading for a temperature is done: A. Orally. B. Orally through a clean canal. C. Rectally. D. Axially. Correct answer: B. Orally through a clean canal. Oral readings are done in the ear. The tympanic membrane shares a blood supply with the hypothalamus, which is an area of the brain that controls body temperature. Provided the ear canal is clean and free from debris, the tympanic temperature is the most accurate. 22. A patient is having difficulty understanding how to properly run her glucose meter. Which of the following teaching methods would best help the patient understand how to use her instrument correctly? A. Give the patient an instruction booklet and have her call the office if she has questions. B. Tell the patient to have a family member demonstrate how to use the instrument. C. Have the patient watch a video on the use of the instrument. D. Demonstrate the proper use of the instrument and then have the patient perform the process while still in the office. Correct answer, D. Demonstrate the proper use of the instrument and then have the patient perform the process while still in the office. By using a demonstration and performance method of patient education, the patient is offered a chance to perform a task and have learning assessed while still in the office. This ensures that any questions that the patient has can be answered immediately and any performance issues that are observed by the medical assistant can also be corrected immediately. 23. The pulse point located on the top of the foot is A. The dorsalis pedis. B. Is checked in patients with peripheral vascular problems. C. Absent in some patients due to a congenital anomaly. D. All of the above. Correct answer, D. All of the above. The dorsalis pedis pulse point is located on the arch of the foot, slightly lateral to the midline. It is frequently used to assess adequate blood flow in patients that have poor circulation. Some patients are born without this pulse point. 24. Over a patient's lifespan, the pulse rate A. Starts out fast and decreases as the patient ages. B. Starts out slower and increases as the patient ages. C. Varies from slow to fast throughout the lifespan. D. Stays consistent from birth to death. Correct answer, starts out fast and decreases as the patient ages. Normal pulse rates in infants average around 140 beats per minute. This rate falls to an average of 80 beats per minute in adults. 25. A common error when taking a pulse is A. Placing the index finger on the radial artery which is located on the thumb side of a patient's wrist. B. Noting a pulse as being weak when the pulsation disappears upon adding pressure. C. Counting the pulse for 15 seconds and multiplying the number by 4. D. None of the above will cause errors. Correct answer, C. Counting the pulse for 15 seconds and multiplying the number by 4. To accurately assess a patient's heart rate or pulse, the pulse must be counted for a full minute. Arrhythmias and intermittent pulsations may be missed if not counted for a full minute. Proper finger placement is on the radial artery which is located on the thumb side of the patient's wrist. 26. A patient is in the office for a cyst removal and is very anxious about the procedure. Which of the following descriptions of his respirations would be expected? A. Bradypnea. B. Orthopnea. C. Tachypnea. D. Dyspnea. Correct answer, C. Tachypnea. Tachypnea is defined as a respiration rate that is rapid, quick and shallow. Patients experiencing anxiety over a procedure may be hyperventilating, which occurs frequently with tachypnea. 27. Rales and rhonchi are frequently noted during an examination of lung sounds. What is the difference between the two? A. Rales are louder. B. Rhonchi are noted only in infants. C. Rales occur on inspiration, rhonchi on expiration. D. Rales are noted only in infants. Correct answer, C. Rales occur on inspiration, rhonchi on expiration. Rales are often heard while a patient is taking in a breath, while rhonchi are heard when a breath being exhaled is obstructed by thick secretions in the respiratory tract. 28. To accurately assess a patient's respiration rate, which of the following methods would be best? A. Tell the patient, please remain silent while I count your number of breaths. B. Count respirations at the same time you are counting the pulse rate. C. Count the pulse rate for 1 minute, then, while keeping your index fingers on the patient's radial artery, count the respirations for an additional minute. D. Count the patient's respiration rate, then take the patient's temperature, and then take the pulse rate. Correct answer, C. Count the pulse rate for 1 minute, then, while keeping your index fingers on the patient's radial artery, count the respirations for an additional minute. The most accurate assessment of a patient's respiration rate is to count the breaths while the patient is unaware that you are doing so. Patients who are aware that their respirations are being counted may breathe abnormally. 29. A patient is diagnosed with essential hypertension. Which of the following blood pressures would you expect to see in this patient prior to taking medications for his condition? A. 142/92. B. 118/72. C. 120/80. D. 138/88. Correct answer, 142/92. Essential hypertension occurs when the blood pressure reading has a systolic pressure reading of equal to or greater than 140 and/or a diastolic reading equal to or greater than 90. 30. The common law source of laws is A. Derived from customs and judicial decisions. B. Derived from the U.S. Constitution. C. Derived from state/federal legislation. D. None of the above. Correct answer, derived from customs and judicial decisions. Common sources of law are found in the history of a civilization and center around that culture's customs and previous judicial decisions. 31. A woman is being accused of failure to pay her medical bills. Which of the following classifications of law is she violating? A. Criminal law. B. Civil law. C. Felony. D. Family law. Correct answer, B. Civil law. Failure to pay for services rendered falls under civil law, as this is a difference of opinion between two parties. 32. A medical assistant graduate wishes to receive credentials in the state of Ohio. She voluntarily chooses to take an examination from the American Association of Medical Assistants. When she passes the exam, she will receive the CMA/AMA credential. Which of the following is true? A. The graduate has elected to become certified. B. The graduate has chosen to become licensed by the state of Ohio. C. The graduate will be registered as a medical assistant when she passes the AAMA examination. D. None of the above. Correct answer, A. The graduate has elected to become certified. Certification and registration are voluntary processes for showing entry-level competency in a field of study. Licensure is a lawful requirement issued by the state government. The CMA/AMA certification is obtained by voluntarily taking and passing the CMA exam offered by the American Association of Medical Assistants. 33. When practicing reciprocity, which of the following is true of the CMA/AMA credentials? A. The CMA/AMA credential indicates licensure in all 50 states. B. The CMA/AMA credential is interchangeable with other medical assisting credentials in all 50 states. C. The CMA/AMA credential is a national credential and may be recognized in all 50 states. D. None of the above. Correct answer, D. None of the above. Reciprocity deals with licensure, not certification. Since MAs are not licensed, reciprocity does not apply. However, many professionals will use the term reciprocity to indicate that a particular certification is accepted in more than one state. The CMA/AMA credentials are recognized throughout the United States, so one may hear the term used in this manner when considering the American Association of Medical Assistants certification. 34. A physician is explaining a procedure to a patient that may cure her recurring staph infection. The doctor explains how the procedure is done, what to expect, the odds of the procedure curing the infection, and possible side effects and risks. The physician is F. Preparing the patient to give informed consent. B. Protecting HIPAA by listing all of the steps of the procedure with the risks involved. C. Not required to inform the patient of any alternative therapies. D. None of the above. Correct answer: preparing the patient to give informed consent. Giving informed consent is the process of giving a physician permission to perform a procedure after all of the risks are made known to the patient. Informed consent is required in most cases, but may not be necessary in some emergency situations. 35. An emancipated minor has come to the office for information on cervical cancer and has also requested testing. The office is not required to inform the patient's parents because A. Cervical cancer is closely related to STDs, so the office is covered by law to not be required to notify the minor's parent. B. Emancipated minors have legal independence from parents or legal guardians. C. Testing for cervical cancer can be done on minors without legal parental or guardian consent. D. None of the above. Correct answer: B. Emancipated minors have legal independence from parents or legal guardians. Emancipation means that a minor has gone to the courts to ask for legal independence from his or her parents and was granted such. A minor that has been emancipated does not have to have permission from a parent to receive medical information. 36. After a lengthy explanation of a medical procedure, the patient asks many questions. The physician answers all of the questions to the best of her ability. The patient then gives consent for treatment. The costly equipment and supplies are put into place and the patient is prepared. 2 minutes before the procedure is to start, the patient begins panicking and changes her mind. Which of the following situations would be the best way to avoid litigation? A. Document that the patient originally gave consent and proceed if the benefits of the procedure outweigh the patient's wishes. B. Have the patient sign a form that she is refusing consent. If she refuses to sign, proceed with the procedure. C. Repeat the explanation of the procedure until the patient understands that having the procedure done is the best form of treatment. Proceed with the procedure. D. Do not proceed. Document the patient's refusal, have the patient sign a refusal to consent to treatment. If the patient refuses to sign the form, have a witness available to sign. Correct answer: D. Do not proceed. Document the patient's refusal, have the patient sign a refusal to consent to treatment. If the patient refuses to sign the form, have a witness available to sign. A patient who refuses treatment has the right to do so at any point during the procedure as long as the procedure has not reached a point where stopping would potentially harm the patient. 37. Advance directives are: A. Required by law. B. Chosen by family members. C. Used to support a patient's wishes. D. Costly and difficult to prove by law. Correct answer: C. Used to support a patient's wishes. Advance directives are a contract in which the patient's wishes for end-of-life care are put into writing. Advance directives are not required by law, but help to ensure that patients' wishes for how they want to be treated if they are rendered unable to care for themselves are carried out. 38. A patient sues a physician for malpractice. The judge awards in favor of the physician. The patient cannot resue the physician due to A. Residential ipso loquitur. B. Residential judicata. C. Respondeat superior. D. Subpoena dutses tecum. Correct answer: B. Residential judicata. The Latin phrase, residential judicata, means that once a case is tried and a ruling is put down, the case cannot be retried by either party. 39. Of the 4 Ds of negligence, which exists when the physician pays for injuries that the client sustained due to improper care? A. Duty. B. Derelict. C. Direct cause. D. Damages. Correct answer: D. Damages. The D, meaning damages, is the negligence topic dealing with how a physician will make a situation right or whole. Damages are often in the form of monetary compensation. 40. Which of the following choices would best answer the question, who owns a patient's medical record? A. The patient. B. The physician. C. The legal counsel of the office. D. No one owns a medical record. Correct answer, B. The physician. Physicians own their patients' medical records, but patients have the right to have copies of their records. 41. Which of the following choices would best answer the question, who owns a patient's X-rays? A. The patient. B. The doctor. C. The facility that performed the procedure. D. None of the above. Correct answer, C. The facility that performed the procedure. X-rays, while considered part of a patient's medical record, are owned by the facility that performs the procedure. 42. Which of the following reasons would be legal when considering a patient's medical record? A. Allowing a patient's brother to view her chart to find out her birth date and address so that he can mail her a card. B. Not allowing a patient to view her own chart because the physician feels this information would be detrimental to her well-being. C. Not allowing a patient to view her chart because she is behind on her payments. D. All of the above are legal. Correct answer, B. Not allowing a patient to view her own chart because the physician feels this information would be detrimental to her well-being. Physicians are not required to tell a patient certain health information if that information will potentially cause harm to that patient. For example, if a patient with very high levels of anxiety learns that she may be undergoing testing for a potentially fatal illness, she may react negatively by having a mental breakdown due to her anxiety. 43. Choose the best answer. To ensure adequate protection for legal issues, offices should maintain patients' charts for A. 10 years. B. Forever. C. Until the age of majority. D. 2 years after the patient was last seen in the office. Correct answer, B. Forever. Keeping medical charts forever will ensure that the charts are available in the event of litigation. 44. The term afferent nerve means A. Carrying an impulse to the brain. B. Carrying an impulse away from the brain. C. Carrying impulses to the motor neurons of the appendicular muscles. D. None of the above. Correct answer, carrying an impulse to the brain. Afferent nerves carry sensory signals to the brain. Different nerves carry motor signals from the brain. 45. The medical term, basophilia, refers to A. An attachment of the epithelial cells of the skin to a basement membrane. B. An overabundance of a particular white blood cell in the peripheral blood. C. An underrepresentation of basophils on a blood smear. D. None of the above. Correct answer, B. An overabundance of a particular white blood cell in the peripheral blood. Basophilia is an increased number of basophils in the peripheral blood. Basophilia is found in certain blood disorders such as leukemia and also in some types of allergic reactions. 46. When considering the structural organization of the human body, which of the following is the basic unit of life? A. Chemicals. B. Atoms. C. Molecules. D. Cells. Correct answer, D. Cells. The basic unit of life is the cell. Cells are made up of atoms, molecules, and chemical structures. However, these items are not considered life forms. 47. When a patient is standing in anatomical position, where are his feet? A. Facing forward with the toes spread open. B. Facing out to the sides to open the hips. C. Side by side and facing forward, toes resting comfortably. D. The feet are pointed inward. Correct answer, C. Side by side and facing forward, toes resting comfortably. A person standing in anatomical position is standing with his feet side by side, palms of the hands facing forward from arms that are straight and slightly away from the sides. 48. A physician asks you to place the patient with his dorsal side facing the exam table. Which of the following accurately describes how the patient is positioned? A. The patient is lying prone. B. The patient is lying supine. C. The patient is lying in the recovery position. D. The patient is lying on his stomach. Correct answer, B. The patient is lying supine. The dorsal side of the body is on the back or posterior. When the back is lying on the table, the patient is facing up toward the ceiling. 49. The body plane that divides the body into right and left sides is the A. Frontal plane. B. Medial plane. C. Median plane. D. Transverse plane. Correct answer, C. Median plane. The median plane, also known as the sagittal plane, divides the body into right and left sides. The frontal or coronal plane divides the body into front and back. The transverse plane divides the body into superior and inferior sections. 50. A patient is asked to abduct her arms. Which of the following accurately describes her arm movement? A. She moves her arms away from her trunk. B. She moves her arms toward her trunk. C. She rotates her arms at the wrists while holding them toward her feet. D. She crosses her arms over her abdomen. Correct answer, she moves her arms away from her trunk. Abduction means to move away from the midline. Adduction means to add to the midline, or bring it closer. 51. Which of the following sets of word parts means pain? A. Dynia and algia. B. A and in. C. Ia and AC. D. Pathy and ausis. Correct answer, dynia and algia. The meaning, pain, can be derived from the following word parts, algia, and dynia. 52. A common childhood illness is caused by the Bordetella pertussis bacterium. Which of the following diseases is caused by this bacteria? A. German measles. B. RSV. C. Meningitis. D. Whooping cough. Correct answer, D. Whooping cough. Bordetella pertussis is the causative bacteria for the disease state of whooping cough. Meningitis can be caused by bacteria, but is not caused by the B. pertussis bacteria. German measles and RSV are both caused by viruses. 53. Which of the following glands found in the skin secretes a liquid called sebum? A. Apocrine glands. B. Sebaceous glands. C. Lacrimal glands. D. Sweat glands. Correct answer, B. Sebaceous glands. Sebum is a fluid that is secreted by glands in the skin called sebaceous glands. Sebum lubricates the skin to help maintain its integrity. 54. A patient that has been diagnosed with alopecia would be described as having A. Body lice. B. Lack of ear lopez. C. Indigestion. D. Hair loss. Correct answer, D. Hair loss. Alopecia is a medical term meaning hair loss. 55. Which of the following anticoagulants would be found in a light blue vacutainer tube? A. EDTA. B. Sodium oxalate. C. Lithium heparin. D. Sodium citrate. Correct answer, D. Sodium citrate. Sodium citrate is found in the light blue collection tubes. This tube is used most often for tests that assess coagulation times. 56. A medical assistant is asked to draw blood in the antecubital AC space. Which of the following veins are found in the AC? A. Cephalic. B. Median cubital. C. Basilic. D. All of the above. Correct answer, D. All of the above. All three of these veins are located in the antecubital space, which is the space opposite the elbow on the arm. 57. A patient's urine specimen tested positive for bilirubin. Which of the following is most true? A. The patient should be evaluated for kidney disease. B. The specimen was probably left at room temperature for more than 2 hours. C. The specimen is positive for bacteria. D. The specimen should be stored in an area protected from light. Correct answer, D. The specimen should be stored in an area protected from light. Bilirubin is easily broken down by light, so all samples testing positive for bilirubin should be protected from light exposure. Any urine samples that are brown in color should be suspect for the presence of bilirubin. 58. Which vacutainer tubes should be used when a requisition calls for blood to be drawn for an H and AMP, H and glucose test? A. 1 light blue, 1 red. B. 2 lavenders. C. 1 lavender, 1 gray. D. 1 green, 1 red. Correct answer, C. 1 lavender, 1 gray. An H and AMP, H stands for hemoglobin and hematocrit, which are tests that are found in a complete blood count. These tests are drawn in a lavender tube. Blood for glucose testing is drawn into gray tubes. 59. Specific gravity in urinalysis. A. Compares the concentration of urine to that of distilled water. B. Is useless when the patient is dehydrated. C. Can only be done with a refractometer. D. None of the above. Correct answer, compares the concentration of urine to that of distilled water. Specific gravity measures the concentration of solutes in a liquid compared to the concentration of distilled water. Normal specific gravity readings of human urine range from 1.005 to 1.030. 60. When placing a patient in the AP position for an X-ray, what position would the patient be in? A. Facing the film. B. Right side against the film. C. Left side against the film. D. Facing away from the film. Correct answer, D. Facing away from the film. The AP position is the anteroposterior projection. Patients in the AP position are facing away from the X-ray film. 61. A patient's urine tests positive for glucose. The doctor asks you to confirm this finding. Which of the following would best confirm this finding? A. Run the urine on the handheld glucometer. B. Have another MA do a repeat dipstick. C. Run a CliniTest. D. Run an ACE test. Correct answer, C. Run a CliniTest. CliniTest tablets are used to detect glucosuria. This test is useful when urines are discolored and proper color assessment cannot be done. 62. The smallest of the white blood cells which also can be involved in humoral immunity is the A. Lymphocyte. B. Monocyte. C. Basophil. D. Erythrocyte. Correct answer, A. Lymphocyte. The smallest of the white blood cells is the lymphocyte. Monocytes are the largest white blood cells. 63. Your doctor has given you a patient memo that he has written. You notice that his grammar and punctuation need to be corrected. Which of the following proofreader's mark signifies that a period is to be introduced into a sentence? A. Equals sign. B. Circle with a dot in the middle. C. Ellipsis. D. Empty circle. Correct answer, B. Circle with a dot in the middle. To show that a period needs to be added to a document that is being proofread, place a small circle with a dot in it in the spot where the period is to be added. 64. As a rule of social acceptance, what is the maximum number of times a telephone should be allowed to ring in most cases? A. 3. B. 5. C. 7. D. 10. Correct answer, 3. The commonly accepted number of rings that a caller will tolerate is 3 or less. If a medical assistant cannot take a call, she should answer the phone and politely ask the caller to hold. 65. When answering the telephone, other than taking a patient's name, what other piece of information should be gathered at the beginning of the call? A. Telephone number. B. Date of birth. C. Reason for the call. D. Address. Correct answer, A. Telephone number. In order to make sure that the office can return a call to a patient in the event they are disconnected, medical assistants should ask for a caller's name and telephone number when answering a call. 66. Which of the following telephone greetings would be best? A. Hello, Dr. Smith's office, please hold. B. Dr. Smith's office, how may I assist you? C. Dr. Smith's office, this is Mary. How may I assist you? D. Dr. Smith's office. This is Mary. Correct answer, C. Dr. Smith's office, this is Mary. How may I assist you? To politely answer a telephone in a professional atmosphere, the receiver should respond by giving the name of the business, the name of the receiver, and an offer of assistance. 67. Which of the following responses would be best when addressing an irate and shouting patient at the front desk? Mr. Jones, I understand your frustration. Please allow me to assist you in getting this issue straightened out. B. Mr. Jones, stop yelling. If you cannot stop yelling, I will have to ask you to leave. C. This isn't my fault. D. Mr. Jones, I'm sure we can fix this issue very quickly. Correct answer, Mr. Jones, I understand your frustration. Please allow me to assist you in getting this issue straightened out. Patients who become irate and begin shouting can quickly become abusive. To help defuse the situation, office staff should be empathetic and offer assistance. Staff should never become defensive or ensure a patient that all of his problems will be solved. 68. Insured mail through the USPS is defined as A. Mail that is guaranteed to reach its intended destination. B. Mail that has value up to a certain amount which can be reimbursed if lost in transit. C. Mail that will require a signature upon delivery. D. None of the above. Correct answer, B. Mail that has value up to a certain amount which can be reimbursed if lost in transit. Insured mail is mail that can be reimbursed by monetary funds if lost in the mail. There is no guarantee that the insured mail will make it to its intended destination. 69. A physician has requested that a letter notifying his patient that he can no longer care for her due to her multiple no-shows would be best sent. A. Insured. B. Parcel post. C. Certified. D. COD. Correct answer, C. Certified. Sending a letter by certified mail will require a signature for the letter which can be used as proof that the letter reached its intended destination. 70. The postal abbreviation for Idaho is A. IH. B. IO. C. IA. D. ID. Correct answer, D. ID. Postal abbreviations are used for all 50 states using 2 capital letters. Idaho is abbreviated with an ID. 71. The standard for folding an 8.5 by 11-inch letter to fit in a number 10 envelope is A. Fold in half long ways. B. Fold in half short ways. C. Fold into thirds by pulling the bottom up and then top down. D. Folding into thirds by pulling the top down and then bottom up. Correct answer, C. Fold into thirds by pulling the bottom up and then top down. A sheet of 8.5 by 11-inch paper is a standard size page. Folding this size paper into thirds by folding the bottom up and then top down is the professionally accepted way to fold a business letter of this size for a number 10 envelope. 72. patients with irritable bowel syndrome will experience which of the following symptoms? A. Diarrhea. B. Flatulence. C. Constipation. D. Patients can experience a variety of symptoms that can include all of the above. Correct answer: D. Patients can experience a variety of symptoms that can include all of the above. Patients with IBS can experience a multitude and variety of symptoms, but the most commonly reported are diarrhea, constipation, and flatulence. 73. Diabetic patients are monitored by using which of the following tests? A. CUB. B. Troponin. C. Phe++. D. HbA1c. Correct answer: D. HbA1c. Hemoglobin A1c is a test used to monitor the average blood glucose level in a patient over a 2 to 3 month period. 74. Patients diagnosed with hypertension are given a medication called hydrochlorothiazide. How does this medication work to treat hypertension? A. It reduces the amount of red blood cells in the bone marrow. B. It allows muscles to contract more forcefully. C. It increases urination. D. None of the above. Correct answer: C. It increases urination. Hydrochlorothiazide is a medication that reduces blood volume by increasing the production of urination by acting as a diuretic. This will lower blood pressure. 75. Psoriasis. A. May be treated with phenytoin. B. Is a skin condition involving flaky or oozing patches of skin. C. Is most commonly found on the backs of the legs. D. None of the above. Correct answer: B. Is a skin condition involving flaky or oozing patches of skin. Psoriasis is a skin condition involving varied maturation of skin cells. Patches of affected skin will crack, ooze, or bleed and may be itchy or sore. 76. Patients who have anxiety. A. Are treated episodically. B. Are treated prophylactically. C. May be treated with citalopram. D. All of the above. Correct answer: D. All of the above. Patients who have been diagnosed with anxiety may be treated as symptoms appear daily to reduce the chance symptoms will appear, and with anti-anxiety or antidepressant medications such as Celexa. 77. Skin nodules, such as nevi. A. May become malignant. B. Should be seen by a physician, even if not suspicious. C. Are graded using an acronym, ABCDE. D. All of the above. Correct answer: D. All of the above. Nevi are also called moles. Moles may become malignant over a period of time. Sun exposure increases this risk. A physician should regularly check moles for signs of malignant changes. Each mole will be graded based on asymmetry, border, color, diameter, and elevation. 78. Category A drugs include those that choose the best answer. A. Can be safely taken during all 3 trimesters of pregnancy according to results from adequate and controlled animal and human studies. B. Have been proven to be dangerous when taken during all 3 trimesters of pregnancy according to results from adequate and controlled animal and human studies. C. Have a high potential for abuse. D. Have a low potential for abuse. Correct answer: A. Can be safely taken during all 3 trimesters of pregnancy according to results from adequate and controlled animal and human studies. Pregnancy category ratings place drugs in one of 5 categories depending on the potential risk to the fetus from the drugs. Category A is the safest category for drugs. 79. Drug schedules. A. Relate to controlled substances. B. Are based on the potential for abuse. C. Are scheduled in 5 categories with Schedule 1 being the most dangerous. D. All of the above. Correct answer: D. All of the above. Drug schedules place controlled substances in categories based on the potential for abuse. Category I drugs have the most potential for abuse, while Category V drugs have the lowest. 80. If a doctor's order calls for the administration of 500 mg of medication, how many grams should be given? A. 500. B. 50. C. 0.5. D. 5. Correct answer, C. 0.5. 1 gram is equal to 1000 milligrams. Giving 500 milligrams of medication would equate to 0.5 grams of the same medication. 81. Which of the following medications would be given to treat vomiting? A. Simvastatin. B. Acetaminophen. C. Lisinopril. D. Promethazine. Correct answer, D. Promethazine. Phenergan, promethazine, is an antiemetic prescribed to treat nausea and vomiting. 82. A patient has been diagnosed with an irregular heartbeat. Which of the following medications would be prescribed to treat this condition? A. Antiarrhythmic. B. Antipsychotic. C. Cathartic. D. Antiseptic. Correct answer, A. Antiarrhythmic. Antiarrhythmic medications are prescribed to treat conditions where the heart is beating irregularly. 83. Which of the following drugs would be used to treat GERD? A. Claritin. B. Nexium. C. Nuprin. D. Celebrex. Correct answer, B. Nexium. Nexium is a medication used to control acid secretions of the stomach and can help to decrease the symptoms of acid reflux. 84. Of the following medications, which is not used to treat depression? A. Sertraline hydrochloride. B. Paroxetine hydrochloride. C. Citalopram. D. Nifedipine. Correct answer, D. Nifedipine. Zoloft, sertraline hydrochloride, Paxil, paroxetine hydrochloride, and Celexa, citalopram, are all prescribed to treat depression. Procardia, nifedipine, is a calcium ion influx inhibitor and is used to treat pathology of the coronary circulation. 85. Which of the following formulas would correctly solve a dosage calculation problem? A. Ordered dosage/dosage on hand, * amount of drug equals dosage to be given. B. Dosage on hand / ordered dosage, * amount of drug equals dosage to be given. C. Amount of drug / ordered dosage, * dosage on hand equals dosage to be given. D. None of the above are correct. Correct answer, A. Ordered dosage / dosage on hand, * amount of drug equals dosage to be given. To accurately calculate dosages, use the formula, ordered dosage / dosage on hand, * amount of drug equals dosage to be given. Amount of drug is the number of capsules, pills, or milliliters necessary to give the dosage on hand. 86. Which of the following agencies would be responsible for monitoring the use of controlled substances? A. CDC. B. FDA. C. EMA. D. FDA. Correct answer, B. DA. The Drug Enforcement Agency has federal jurisdiction over controlled substances that are prescribed in the medical office. 87. A medical assistant is going to give a subcutaneous injection. Which of the following is true concerning this procedure? A. No more than 2 milliliters of medication should be injected using the SUBC method. B. The angle of the needle should be 90 degrees. C. The injection can be given in the antecubital space. D. The needle length should be greater than 1 inch. Correct answer, A. No more than 2 milliliters of medication should be injected using the SUBC method. Subcutaneous injections are given in the fatty layer of the skin at a 45-degree angle. This injection procedure is used for medications that do not exceed 2 mL. The outer arm is the most common area for this type of injection. 88. Elizabeth Kubler-Ross is known for developing the stages of grief. Which of the following is true of these stages? A. All patients will go through all 5 stages of grief. B. Each patient will go through the stages of grief in the same order, but not necessarily in the same amount of time. C. Each patient who goes through the grieving process will experience some or all of the stages of grief in varying amounts of time. D. The stages of grief are an antiquated method of psychology and are not recognized in current practice. Correct answer: C. Each patient who goes through the grieving process will experience some or all of the stages of grief in varying amounts of time. The stages of grief are different for each person experiencing loss. The time spent in each stage and the order of the stages can differ greatly between those coping with loss. 89. The hierarchy of needs was proposed by which of the following psychology researchers? A. Maslow. B. Freud. C. Erikson. D. Skinner. Correct answer: F. Maslow. Abraham Maslow is credited with defining the hierarchy of need. The hierarchy of needs are ranked in order to include physiological needs, safety and security, love and belonging, esteem and recognition, and finally self-actualization. In order to progress from one level to the next, subjects must satisfy the current need. 90. Which of the following scenarios accurately describes self-actualization? A. Finding belongingness to a group. B. Recognizing one's worth to society. C. Feeling safe in one's environment. D. Reaching one's full potential. Correct answer: D. Reaching one's full potential. Self-actualization is the final stage in the hierarchy of needs by Maslow. This stage defines reaching a person's highest potential and can vary greatly from person to person. 91. According to life's 8 development stages, trust and mistrust are most likely experienced. A. Shortly after birth. B. The pre-teen years. C. Middle age. D. Old age. Correct answer: shortly after birth. Erik Erikson defined psychosocial development based on 8 stages ranging from birth to death. Each stage defines an ongoing pattern of psychosocial growth. In order of appearance, the 8 stages are trust versus mistrust, autonomy versus shame and doubt, initiative versus guilt, industry versus inferiority, identity versus role confusion, intimacy versus isolation, generativity versus stagnation, and ego integrity versus despair. 92. Classical conditioning is demonstrated in which of the following examples? A. A child starts crying upon mention of going to the doctor. B. A dog barks when seeing a stranger. C. A patient is startled when a medical assistant quickly opens a door without announcing his presence. D. A baby boy urinates every time his diaper is removed to be changed. Correct answer: A. A child starts crying upon mention of going to the doctor. Classical conditioning was described by Pavlov in a famous experiment involving a bell and a salivating dog. This theory of learning is based on obtaining a desired reaction based on giving rewards. Just as Pavlov was able to stimulate a dog to salivate by ringing a bell, children can be conditioned to associate pain with a visit to the doctor. From remembering previous visits that were unpleasant, such as receiving injections, children will start to associate the doctor with pain. 93. B.F. Skinner is regarded as being the primary researcher for which learning method? A. Classical conditioning. B. Operant conditioning. C. Trial and error. D. Kinesthetic learning principle. Correct answer: B. Operant conditioning. Operant conditioning explores the relationship of obtaining a desired outcome with both rewards and punishment. B.F. Skinner is famed for using the Skinner box, which used a controversial method of studying operant conditioning. 94. Nonverbal communication is A. Not the most utilized form of communication. B. Uses facial expression and body language to send messages. C. Most often used when sending messages over email or telephone. D. An ineffective manner of communication. Correct answer: B. Uses facial expression and body language to send messages. Nonverbal communication involves communication that is given by body language. Most messages are sent between sender and receiver using nonverbal communication. 95. Which of the following scenarios provides an example of a medical assistant overcoming a barrier to communication? A. A medical assistant uses a lecture as a means of explaining how to run a finger-stick glucose test to an elderly patient. B. A medical assistant writes her directions to a patient that is hearing impaired. C. A medical assistant speaks loudly to a patient who speaks a non-English language. D. A medical assistant uses the terms micturate and defecation while talking with a minor. Correct answer: B. A medical assistant writes her directions to a patient that is hearing impaired. Overcoming barriers of communication involve using methods of communication that are understandable to the receiver. In the example provided, a deaf or hearing impaired patient would have an easier time understanding directions if they are written to overcome the obstacle of hearing loss. 96. Of the following choices, which should not be considered when performing payroll functions? A. Number of exemptions. B. Deductions. C. Hours worked. D. Number of patients roomed per day. Correct answer: D. Number of patients roomed per day. Payroll is the process of calculating how much is owed an employee based on the employee's salary and number of hours worked. Deductions that are made based on taxes are also calculated from an employee's gross pay. 97. Which of the following tasks is not the responsibility of the office manager? A. Maintain adequate supply of inventory. B. Perform employee evaluations. C. Ensure adequate staffing. D. Determine the appropriate number of tax exemptions that should be made by an employee. Correct answer: D. Determine the appropriate number of tax exemptions that should be made by an employee. Office managers have the responsibility to keep the office running smoothly by handling employee issues, monitoring inventory, ensuring customer service excellence, and adequate staffing. Choosing the amount of tax exemptions that each employee should take is the responsibility of the employee. 98. What is the best time of the day to hold an all-staff meeting? A. Right after lunch. B. Just prior to the office closing. C. At the beginning of the day. D. Various times of the day. Correct answer: C. At the beginning of the day. Staff meetings should be held at the beginning of the day or the beginning of a shift to ensure that enough time is set aside to cover all of the topics on the agenda. 99. Which of the following employment forms is necessary when considering choosing tax exemptions? A. W-2. B. W-4. C. I-9. D. C-3PA. Correct answer: B. W-4. W-4 forms are the federal forms used to choose exemptions. 100. When setting up the front desk, which of the following would enhance patient privacy? A. Having a sliding window that can be closed when not conversing with patients. B. Having a privacy filter on computer monitors. C. Asking patients to stand at least 5 feet from the front desk until it's their turn. D. All of the above. Correct answer: D. All of the above. Patient privacy is mandated through HIPAA. Any procedure that will protect patient information will be useful in protecting privacy. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.